Now we're going to hear from Dr. Phillip Chan.
Thank you. Good afternoon, everyone. I'm pleased to be here as a community-based physician and also as associate professor in the Department of Medicine, School of Public Health at Brown University. So I want to thank Dr. Nunn and R.I.P.H.I. For leading this initiative, as well as Senator Lawson and State Rep. Barrows. Thank you very much, and the rest of the legislators who are here. So as you've heard today, these important bills before the state legislature offer significant benefit for all of Rhode Island. They truly are a win-win for people, for the community, and for public health. As these bills are discussed, I would ask everyone to consider the data, the science, and the evidence, and let's base our decision on that. And we've heard a fair amount of evidence today about in support of these bills and the benefit that they would offer Rhode Islanders. We know that these sugary beverages are a leading cause of obesity in the United States and in Rhode Island. In fact, Rhode Island ranks 11th in terms of obesity in the entire country, 11th. That should be alarming and call for action for all of us. As we've heard, obesity is a direct cause of serious health conditions like diabetes. We all know someone, either personally, in our family with diabetes, and it's something that we need to address. Importantly, in places where these bills have passed, people decrease their consumption of sugary beverages, like soda. This is a good thing and will lead to improved health here in the state of Rhode Island. In fact, when patients ask me as a physician, what is the number one thing that they can do to lose weight, or if they're pre-diabetic, my answer is always to reduce your consumption of soda and other sugary beverages. It's literally one of the best things we can do health-wise besides quitting smoking or exercising. In fact, all the state's major medical associations have signed on. This includes doctors, nurses, physician's assistants, and other medical providers. In addition, as we have heard, these bills would also fund SNAP incentives for people who are in need. And as you've heard, hunger is critical in Rhode Island. SNAP incentives are a critical public health safety net measure for this state. Again, it really is a win-win for people, for the community, and for public health. And finally, I just want to say, as we come out of this pandemic, and given that many of us, including myself, have probably gained a few extra pounds, please make sure to check in with your primary care provider. And I'll make a plug. As Chief Medical Officer of Open Door Health, we are seeing patients. I know many of my colleagues across Rhode Island, primary care providers, others, are also taking patients. So check in with your primary care provider, get some of that preventative health that has been lagging behind the pandemic. It is really nice to be here to talk about something other than COVID. Thank you all for your support.
Thank you, Dr. Chan.